Hello, I'm Dr. Michael Walker, a facial plastic surgeon, and I'm going to talk a little bit about facelifts. Facelifts are a procedure that we get required to do quite often because of patients experience the changes of aging. As a person ages, there are three things that generally occur that cause the appearance of wrinkles and sagging and so forth. The first thing that occurs is that the collagen starts to get a little bit loose and lax, and the skin becomes loose, and things start to sag. The second thing that occurs is that the surface of the skin becomes wrinkled or irregular and gets pigmentations. And the third thing that happens is the patient loses volume to the skin. That's usually from fat atrophy. Now, Angelina has good features and she still has quite a young appearance, but I can show some of the areas that change with aging. There's a fat pad right in this area right here, and as we get older, this fat pad is pulled down by gravity and starts to drop. That causes some jowling right along the jawline right here. Due to the constant turning of the neck and stretching of the neck, the skin under the neck also becomes loose. Occasionally, if the patient gains weight, they may get some fullness down here as well as loose skin. So the most common complaints we get from aging women is the jowling right here and the loose skin of the neck. They also may experience some creasing or wrinkling here in the nasolabial fold as this fat pad comes downward. Another area that becomes to wrinkle or starts to age is this area right here. Lines develop, we call those marionette lines, kind of like on a puppet where his jaw goes up and down. The facelift is used to elevate these tissues back to their normal positions, up over the cheekbone, and to tighten up the jawline, and also to tighten up the neck. Now, your classical facelift addresses the lower two-thirds of the face, which is the cheek, the mandible, and the neck. The brow lift, which you've heard of, only addresses the forehead. Gravity also takes its toll on the upper eyebrows, and they start to fall down closer and closer to the eyelids, and then the skin of the upper lid starts to duplicate, wrinkle, and lap over the eyelashes. Many times with a brow lift, we can correct the redundant skin of the upper lid as well as correcting the wrinkles in the brow. This previously was done with incision across the top of the head, but with new technology we can do this endoscopically with small incisions behind the hairline to lift the skin off the forehead and then pull the skin up and reposition the brows. My personal preference is tissue glue, but some physicians use screws or sutures or other things to hold the tissue in place. Now, the facelift has several variants. I feel that probably the classical facelift gives the best result. But for patients that don't have as much ptosis or dropping of the jaw, someone who is young like Angelina and just barely showing some of the signs of aging, we consider an S-lift. An S-lift, let's turn your head this way a little bit, is called an S-lift because of the letter S. The incision is under the skin, in front of the ear, and then right behind the earlobe, like a letter S. And through that incision, we can get under the skin, grab the muscle layer underneath, and then pull it up and tighten the skin and remove the excess skin. Now, for a person who has a lot of laxity, loose skin in the neck, we have to do the classical facelift because most of that skin is pulled back and away behind the ear, and the incision has to be extended back along the hairline. Now, another new procedure that is becoming more popular is called the thread lift. A thread lift uses a plastic suture that's been around for 20 years, and they put little nicks in it to create barbs, kind of like a porcupine quill. And by inserting that thread underneath the skin and then pulling back, the little barbs catch the tissue and elevate it. The suture is then fixed to other tissue up higher in the scalp, and that keeps things in place. Now, the thread lift, in my experience, has a very, very limited application, and it's usually for patients under 35 with very minimal aging changes. And it doesn't last quite as long as the typical facelift. The typical facelift lasts probably 8 or 10 years. The thread lift, in my experience, only lasts a year or two. So the patient has to make a trade-off between a low invasive non-surgical approach to a more invasive approach that takes a little bit more time to recover from, but they get a much better result from a facelift than they do from a thread lift. Let's see, Angelina, I'm going to talk a little bit about the face as far as anatomy. The face we divide into thirds. The brow to the hairline is usually 1/3. The brow to the upper lip is the middle third, and then from the base of the nose to the chin is the lower third. In our definition of beauty, we find that the women who are classified as the most beautiful usually have equal ratios between these three areas. And Angelina's got a good ratio too. I think she would qualify for that. Now, let me address facelifts a little bit about recovery. The thread lift is done in the office. Its recovery is just several days with a little bit of swelling. An S-lift, there's a bandage overnight, and the patient has to kind of be careful for about a week afterwards, but we've had people go back to work in 3 or 4 days after an S-lift. The facelift, though, requires a little bit more time to recover from. It's usually about a week or 10 days. There's a little bit more bruising and swelling. The stitches stay in for about a week. Now, occasionally patients will have skin changes where there's roughness or wrinkling of the skin that the facelift will not tighten out. In that case, we do what's called a peel, either a chemical peel or a laser peel. It's a second-degree burn to the skin, which causes some blistering, but it induces rejuvenation and collagen formation in the skin that fills out the skin, smooths out the wrinkles, and removes the little irregularities of the surface. Many times we'll do a chemical peel just around the mouth or maybe around the eyes. Occasionally we'll do a chemical peel with the whole face. The chemical peels are a little bit more difficult to recover from because you have basically a raw surface area, second-degree burn for a week. The patient has to apply ointment around the clock, wash it off 4 or 5 times a day, and reapply it until that new epithelium comes in. But once the skin has healed after about a week, it's very pink. You have to take precautions to stay out of the sun, but the results are quite dramatic after the chemical peel. Many physicians like to use a laser as well. Well, Angelina, I think that's probably all we can really cover today as far as facelift. I'm kind of disappointed you're not more wrinkled and aged here that I can point things out, but you've taken good care of your skin and it looks quite nice. So I can't recommend a facelift for you today.